Thank you, Dr. Al-Athman, for this rich and very informative review. Now we move to the next talk by Dr. Saeed AlGhamdi. It's my pleasure to introduce to you Dr. AlGhamdi. He is a consultant nephrologist and the chairman of the Department of Medicine at King Faisal Specialist Hospital and Research Center in Jeddah. He's a director of renal dialysis unit for more than 10 years. He's assistant professor of medicine at King Abdulaziz University in Jeddah, and he is the president-elect of Arab Society of Nephrology and Renal Transplantation from April 2008. Dr. AlGhamdi has his training in nephrology back in 1991, and he completed his training by 1994 in nephrology and transplantation. He completed his training in University of Ottawa and then in University of British Columbia, Vancouver. He's a member of several nephrology, transplantation, and internal medicine societies and associations. He's well known by his exceptional interest in teaching, despite his huge administrative responsibilities. And I am personally a student of Dr. AlGhamdi. He's also interested in research and has been involved as a speaker in multiple national and international meetings. Dr. Saeed AlGhamdi has a number of publications, and his special interest is in hepatitis C virus in renal population and catheter-related bloodstream infection, lupus nephritis, and magnesium role in health and disease. Dr. AlGhamdi will be talking about the effect of Ramadan fast in kidney transplant recipient. Dr. AlGhamdi.
Thanks, Abdullah, very much for this very nice introduction. It's a pleasure to be here with you, and I'm try to talk about fasting Ramadan for transplant patients, and we'll discuss a little bit about Ramadan and fasting for somebody who's not from Muslim community, and why we are really concerned about the fasting Ramadan transplant patient. And we'll discuss about the fasting in normal subjects. Then we'll move to fasting in patients with the CKD who are non-transplanted. And then we'll go to the subject of this presentation about fasting in transplant patients with near normal GFR or with abnormal GFR, and then we'll leave with some recommendations. Ramadan, for who doesn't understand, Ramadan is the ninth lunar month of Islamic calendar, where it's usually it moves 11 days every year, where it's really sometimes fall in the summer, sometimes in the winter, and can move into all seasons. And considered for Muslims one of the 5 pillars of Islam, and it's probably the holiest month of the calendar. And this month, that's obligatory for all adult capable Muslims to fast 30 days almost, and they should abstain from food and fluids for almost 12 to 14 hours, depends from the area, location, and the season. Of course, patients, children, and menstruating women, and also lactating women, mothers, are exempted from fasting. But we face frequently with patients, despite that they are exempted, that they want to fast. And this is really sometimes most of our colleagues in the transplant field, they have mixed messages regarding this issue. So I really thank the organizing committee for assigning this subject in order that we shed some light on this really novel and interesting area in the field. The concern over that fasting in Ramadan for transplant patients, that it's really long fasting hours, sometimes can extend up to 14 hours, especially in summertime. And the hot weather and the humidity may affect the hydration status of the patient. Of course, there is lots of thoughts in the literature talking about the concentrating ability of the transplant kidney, whether it's really able to concentrate the urine and to do the same like non-transplant normal individuals. And also there was also concern from many of the transplant nephrologists and transplant surgeons about the absorption of immunosuppressants in relation to meals, especially that if you look at the patient, they take the medication immediately after breaking their fast and also before they start fasting with food. And also because actually it's a tradition in our area here that most of the food really they consume during Ramadan is really containing high content of potassium. So this is actually also an issue and a concern. But from all of these, dehydration, hence elevated creatinine, was really the most point that we should really actually draw attention. Also the electrolyte disturbance, and we are really afraid about inadequate immunosuppression. If you look at about fasting in normal individuals, I'll not discuss lots about it, but of course it has been shown without many data that Ramadan fasting did not significantly affect urine volume, osmolality and serum electrolytes, and electrolyte excretion. And change in urea and creatinine is usually very small and statistically insignificant from non-fasting population, and has been shown at least for 3 studies. So for that reason, in healthy subjects, fasting Ramadan does not induce abnormality of the urine volume, pH, electrolyte excretions, and also for urea and creatinine. How about fasting in patients who have CKD, especially stage 3, 4, and 5? If you look at the study which I'm going to discuss today, one of them is our colleague, Hala Wakil, who's sitting here in this audience. She actually studied about 15 patients prospectively who with the control about 6 normal subjects, and she used DTBA to estimate GFR, and she also estimated some of the parameters of the tubular damage, like NAG, was measured in the urine in both groups. What she found, Hala, that there is no difference in GFR between both groups in terms of with fasting. So the creatinine does not worsen during fasting, similar to the control group. She found also that there is a decrease in NAG in fasting group compared to control. The mean NAG is in CKD based about 236 compared to control of 46. And that's why she alluded and she concluded that fasting Ramadan may have injurious effect on renal tubules of pre-dialysis patient. But again, she discussed this with the subject with her. She said probably a patient who had actually CKD secondary to tubular disease, like interstitial nephritis or others. But in general, this is the only study which I have seen which has used DTBA and NAG in looking at this. There's a second study which has been done by Bassam Barniya from Al Ain University, where he looked at his colleague at prospectively on 31 patients in different stages of CKD, 3, 4, and 5. And the mean estimated GFR in their study group was 29, and primary cause of usual CKD diabetes and hypertension. If we look at the data of Bassam Barniya, that the pre-Ramadan fasting serum creatinine did not worsen or nothing. It's the same pre-Ramadan, during Ramadan, and post-Ramadan. And so it's really there is no change. And when he looked at the eGFR using Cockcroft-Gault equation, he found that the GFR actually is better post-Ramadan than in the transplant group. But again, this probably due to just Cockcroft-Gault equation. But in general, that there is no change in the serum creatinine from pre-fasting, during fasting, or after fasting. Similar this one to the urea, and he concluded that Ramadan fasting no change in serum creatinine or even better GFR, and it's safe to fast Ramadan in CKD patient irrespective of CKD stage. We look actually right now to fasting Ramadan in renal transplant recipient. Before I discussed 2 studies about CKD patient, non-transplant patient. But if you look at fasting in renal transplant recipient, there are at least 5 studies which has been published in the literature. I'll discuss the first one, which was done by Dr. Abdullah Al-Khadr Al-Sayari group, and here in the audience, Dr. Jana Musa was one of the authors, and Dr. Faisal Shaheen too. This published in American Journal of Nephrology, which looked at the effect of Ramadan fasting on Muslim kidney transplant recipients. And it's a prospective study. They looked at about 23 patients. 17 of them, they have normal or near normal GFR, and 6 with abnormal GFR but stable function. Creatinine at that time was about less than 300 micromole per liter. The mean post-transplant period was 2 years, but it's ranged from 6 months to almost 6 years. And mean age of the patient was 35 years. Blood was taken before and after, and weekly during the month of Ramadan. And what they found actually that creatinine increased a little bit actually, but did not reach any statistical significance in all groups. And we look at cyclosporine also, did not reach any, there is no change in the cyclosporine level, and did not reach any statistical significance. Similar to potassium, but potassium actually increased from 4.12 to 4.6 with fasting, because I said earlier that we consume lots of potassium containing food, and that reached actually statistical significance. But nevertheless, the increase in the potassium was within normal limit and did not increase above the range. So, and we looked actually in the low GFR group, and they found the low GFR group again did not change differently from before Ramadan fasting, during Ramadan, or after Ramadan, similar to cyclosporine and even potassium. So Dr. Saeed and his group, in their patient, that all patients managed to fast month from Ramadan without an adverse effect, and there was no significant change in serum creatinine, no change in cyclosporine level, no change in electrolyte except a minimal increase of potassium, although within normal limits. So, in their conclusion that Ramadan fasting is safe in patients with normal or impaired GFR who fasted after the first year of transplantation. Second study came from Kuwait, from Dr. Dr.Saeed and the group, the Kuwait, published a transplant proceeding 2003. They have almost 145 patients, prospective, as they said, 71 fasting group and 74 as control. And they chosen patients with stable graft function more than 1 year from transplantation. And what they found, actually, there is no change in serum creatinine and urea between both groups. CNI toxicity occurred in 2 patients who fasted, and acute rejection developed in 2 patients but was reversed. But at the end, there is no graft loss, and Ramadan fasting was considered to be safe. The third study which I'm discussing right now is coming from Iran, from Dr. Ayn Ilahi, who actually, in my judgment, one of the best study published in International Urology and Nephrology. They looked at the group, divided the group to 2 groups, 41 patients between faster and non-faster. And actually both groups are controlled for age, duration of transplantation, and their GFR. And the mean transplant period between both groups were almost equal. If you look at all over the patient's population, they found that pre-Ramadan, the estimated GFR was 72, post-Ramadan 73, and we look at the control is the same. So it's here that the treatment or the fasting group with the control group, there is no significant difference between both of them, and also for systolic and diastolic blood pressure. If you look, they divided their patient to patients who had better GFR more than 60 micromole and patients who less than 60. And again, the patient with less than 60, more than 60 with excellent GFR, they have actually no difference between the fasting and pre-Ramadan and post-Ramadan. So the patients, they worked as their control group between and after, before and after Ramadan, and there is no difference in their estimated GFR. Similar this to the diastolic and systolic blood pressure. If you look at the patient with low GFR less than 60, their mean GFR in the pre-Ramadan time are 48.8, post-Ramadan 49. Again, there is no significant difference. Similar for systolic and diastolic blood pressure, which tells you that's really quite safe for those patient population to fast, and there is no deterioration in their renal function respective to their GFR. So the actually conclusion that Ramadan fasting for renal transplant patients who have normal or mild renal impairment is safe with no ill effect. The other study which I'm discussing, actually the most recent of them, actually by Dr. Bernia and Dr. Boubis from Al Ain University in Emirates, where they looked at the same issue. And their study actually is also prospective. The number of their 22 patients, the mean age about 47, the mean GFR in their patient was about 68. 16 of their patients, they have good GFR, 6 they're less than 50. And beach transport period about 79 months, ranging from 14 to 250. When they looked at the patient, all patients managed to fast with no clinical ill effect, and there is no change in creatinine, urea, and electrolyte in patients with GFR more than 50 or patient with GFR less than 50. So they consider Ramadan fasting is in patients with a stable GFR who has been more than 1 year from transplantation is safe to do. Now we discussed this actually about fasting Ramadan, but how about repeated fasting of Ramadan? And there's a very excellent paper of Dr. Abdullah Saeed and group from the National Guard from Riyadh here, where they looked at repeated Ramadan for 3 consecutive years, whether that will affect GFR. What they did actually is a prospective controlled study where they divided their patients 35 in the fasting group, 35 who do not fast, And both groups are comparable for gender, age, type of transplant, and duration of transplantation. And there, the randomization, actually, it happened that the serum creatinine was higher in the control group than in the fasting group, 175 versus 157, and 63% of the patient has GFR less than 60. The result of their group actually found that from baseline to after third fasting, so they fasted 3 consecutive years. After 3 years from fasting, the change in the serum creatinine was really very minuscule and did not reach any statistical significance, and also the same for the GFR. They found that change in GFR is really minimal for the fasting group, and change in blood pressure is minimal also, and also in the proteinuria. So it did not affect GFR, did not affect arterial blood pressure, did not affect the protein excretion. So they found no significant difference in GFR, mean arterial pressure, urinary protein excretion between repeated fasters and the non-fasting group. So fasting and repeated fasting is stable transplant recipient, does not affect renal function. That's their conclusion. So they say there's no effect. That's actually all the studies regarding the transplantation, but it has been a custom of most of us working in transplant nephrology to advise our patients not to fast before the first year of transplantation. How about fasting within the first year of transplantation? I found only one study coming from Algiers, only 14 patients, they fasted within the first year of transplantation. There's 13 patients, they fasted within month and 7 months. It's really quite strange, honestly, because this is against the norm, which we do. But nevertheless, they did it, and they found all their patients all living related with stable graft function. Serum creatinine was 93 micromole, and there was no control group in the study. No change in serum creatinine was found after completion of month of Ramadan, and there was no rejection episode. That's actually the data which we have right now from the literature regarding the fasting Ramadan for transplant population, but still we do have some unanswered questions. First of all, fasting in non-transplant CKD patient with advanced stage of CKD. I brought you to study of Halal Wakil and Bassam Barniya, but nevertheless, the number of the patients is really quite small and is not stratified according to the stage of CKD. So actually we need to have this information in larger patient population to look at each stage, 3, 4, 5, pre-dialysis, I mean. Number 2, fasting is less than 1 year of transplantation. I know this data coming from Algiers, which I respect, but I think we need actually to do more in this field because if this is really true, although most of us will find it really difficult to convince himself before the patient that this is the right way to do. Redoing the study with better quantitative measures. You look at all the study, some of them they use creatinine, some of them they use Cockcroft Gold, some of them MDRD, and Halal Wakil she used the DTPA, and I think we have to standardize form and we have to have better, larger patient population. And we do actually, they're doing these studies from different geographical area and different seasons. And the reason for that probably because if you looked at all the study, it has been done in the good winter season. They are done actually around, except Dr. Saeed, which is, actually it's all of them actually, the temperature was really mild. It's not really hot. This is the right time actually to do more studies because we're expecting really, really bad weather to make actually final conclusion. So actually, if you allow me, I recommend that fasting Ramadan based on the current literature is safe in the following patients. First of all, they have to have 1 year after transplantation. Number 2, stable kidney function in the preceding 6 months from fasting. Of course, still we have to look to close monitoring of patients with low GFR because I don't think that we have really good, accurate answer in this patient population. And regarding the medication, we just switched the medication, the morning dose to be an iftar time with sunset, and the PM dose to be moved to the suhoor or the dawn time. In conclusion, fasting Ramadan patient at least 1 year from transplantation with stable graft function is considered safe. Fasting does not affect negatively the renal function, electrolyte, or urinary osmolality and protein excretion. And finally, repeated Ramadan fasting is considered safe in stable transplant patient. Thank you very much.
Thank you to Dr. Saeed for this nice and very informative presentation. We move now to the next speaker, Dr. Dujana Musa. Dr. Dujana is a consultant nephrologist. She is the head of renal transplant program in Riyadh Armed Forces Hospital in Kingdom Saudi Arabia. Dr. Dujana actually is amongst the first batch of students in King Abdulaziz Medical School, Jeddah,